Yeah, okay. Okay, now this is live. So now, people will probably be like, oh, pop in, oh, pop out, oh, pop in,
yeah.
oh, pop out. So there's got that.
Just like, hey
Just
guys.
like, hey.
Hey there.
Okay, this is still recording, so I got that going. And then I can probably look at Facebook on here because I'm not really too concerned about this video. So, because like look at that difference. Like this one is so much more better.
Over here. Yeah.
So I'm just gonna put this over to the side. I know that's recording. Make sure it is. Okay. Triple check everything.
Yeah, I feel you. I would be the same way.
And then it doesn't know what to do with the live on that and this over here. Okay, well it'll be good. And then I gotta get this one up there. And then I gotta finish. Hey, we have one person. Hello. We're just getting settled here, guys. Give us 1 second. I hope you're having a great Sunday. Hope you guys can actually hear us because it's kind of important too.
Yeah, I guess if you can't let us know, please, my God.
Like send me a direct message. That would be great. So we got Jaden, who had the pleasure of doing orientation, Trolix Neuro. Need to be strong and comfortable enough to advocate, self-advocate.
Yeah, that's super important.
Speak up. Skill level. Not okay for assignment. Speak up. Oh, look at that. Hey. No, right? Just like,
we're famous. Just kidding.
I really hope they're just like, what the?
They're like, all right, maybe we shouldn't do that. Just kidding. Like, these girls are crazy.
Tucker's gonna be in here too.
Hey, buddy.
Time management, checklists. Okay, I'm just going to keep this up.
Yeah, I feel like there's a lot of like time management questions.
Yeah, for
self-advocate.
Perfect. Drips, compatibilities. Okay, there's that, and then just checking Instagram one more time, and then plugging it in, and we will be going. All right, look at that. It's climbing. Hello, everyone. So we're just going to be getting started here in probably 2 more minutes to just kind of allow anyone else to kind of peep on in here. So we're just writing down questions. If you have any questions, send us a message, and hopefully we'll be able to find it and look at it. Yeah, and if not, you can probably send Malyssa a text message or DM on Facebook as well, and you should be able to get your questions answered. And then there's one person who said, any skills think missed when you don't start on the floor and do nurse.
Oh yeah, sorry, what was that?
So any skills missed you think are missed when you don't start as a floor nurse.
Oh, okay.
Floor nurse. So pros and cons.
Yeah. Were you in your grad too or no?
Yeah.
Okay.
So into burn, but it's like a little easier transition. Yep, into cardiac ICU.
Yeah, well, let's try to think about that a little bit then. Obviously, yeah, like either was on personal experience with that, considering we went straight there, but yeah, I'll keep this close by just in case. But
alright, I almost forgot to plug this in. It would have died in like 2 seconds.
Tucker's just really in
like,
this blanket.
What dog is over there? This is kind of cool, so you can see all the setup behind everything here. With this over here. So I gotta hurry up because I don't want them to wait longer than 5 minutes. Live. Should do Moody Fall.
Yes, 100%.
You can find it. Where is it? There we go. I like that. Checking connection. You're not live. Okay. All right, welcome to the Bedside Matter podcast. My name is Dani, and this is...
Hi, I'm Malyssa. I don't know who all is in here, but I'm sure some of you know me from work. But so yeah, I'm an RN on the CVICU at Essentia in Duluth. So Dani and I are coworkers. That is one of the best things to come out of the CVICU combination. So
yes,
meeting new people, making new friends. So yeah, so I've been working as a nurse there for a little over 2 years. I hit my 2-year mark in July. And I was a new grad into the ICU. So kind of I think at Essentia, at least one of the newer, like kind of the first round of people kind of to be a new grad in the ICU. So
So would you go to school and just kind of tell me just a little bit about like why you just chose to be a nurse and like what kind of led you there?
Yeah, so I went to Scholastica, so in Duluth here. And my path to nursing was, I always knew I wanted to be a nurse, but I actually ended up going to randomly NDSU for my first 2 years.
Oh, I didn't actually know that.
Yeah, so, and actually I just like nothing against North Dakota or anything, but just, it wasn't for me. So I was really happy to move back home, and I transferred back to Scholastica, and I was much happier. So it took me, about 6 years to get my nursing degree, which was not ideal, but it happens.
Sure does.
And so, yeah, both my parents are nurses, so I've grown up with it literally my entire life. So my dad is a CRNA, and my mom's a nurse practitioner.
Oh, great.
So, yeah, I've literally known, like, nothing else my whole life, and I've always thought it was interesting and exciting, I guess, and I guess I never thought that I could, like, have a job that felt fulfilling to me, and, like, that was helpful to other people, and that also I actually enjoyed learning about and was interesting at the same time. So I really felt like nursing was, like, my dream job, to be honest, and I've been doing it ever since.
Awesome. So you've been in the ICU for 2 years, and so originally, so she was in CICU, and I was in SICU, and then over the course of the spring here, we have combined units, and so now SICU and CICU are now together, and there has been lots of many pros and cons to combining both of those units, but it's been really nice to be able to meet excellent, fabulous new people. So I think that's been great because the camaraderie has really been helpful to pull us through this whole COVID pandemic, and then just being able to just rely on people who are literally going through the exact same thing. And that's one of the main reasons why I wanted to start this podcast, was to just kind of let everyone know you're not alone in how you're feeling, and there's lots of things going on, and like there's tons of people who are brand new grads in the ICU, and I feel like for a lot of us, I was also a brand new grad in the ICU. I started in burn ICU, then transitioned to surgical ICU, so I transitioned into a cardiac surgical ICU. So there's just so many people who are literally going through the exact same thing, and that is why we are here. So, and I think, so Lex just kind of popped on here. So Lex was one of my last students. Hi, Lexi. I don't know if you're still on there, but if you're still here, hi. And she was one of the last students I had during this pandemic, and then she actually wasn't able to finish.
Before all the students had to leave.
I know, it was so sad. My heart was broken, so. So yeah, so that's just a little bit of background information, and we're gonna get cozy. Would you like a glass of wine? Do you think I should?
I'm good for now, actually. You go for it, though.
No, I'm not. Like, it's already like
there's no judgment here, so.
Yeah, so like if you guys want to have some wine, like go ahead, please do. We'll get cozy here. So I think we're just gonna kind of start to just talk about tips for brand new ICU RNs based on who I'm seeing here in the audience. And so what we have down here for people who've asked questions are, so people want to hear about time management. So Malyssa, what do you have to say about time management in the ICU as a new grad?
It's probably, honestly, the answer I have is probably one that no one wants to hear. I really think no matter where you start as a nurse, time management is really just something that takes time. It really is. I think it's just an experience thing for the most part. So I would say that's one of the arguments for why people say that maybe you should be a floor nurse before you go to the ICU, because then generally speaking, you'll probably have your time management figured out, and then you maybe won't feel so overwhelmed, so you won't be trying to learn time management and how to be a nurse on top of how to be an ICU nurse as well. Yeah, so I think that's definitely kind of one of the arguments that people make for why you should or shouldn't do it. I was able to manage it myself, and I think it's just really a personal thing. I think either some people can cope with kind of the stress of learning those things, and some people can't, and I think you just have to know yourself. And I know it's hard for, not everyone can do this, but if you have the opportunity, I mean, really try to be in an ICU for clinicals if you even think, like, for a second that it's an interest for your career, because then you can at least have a decent idea on, if it's too much for you or not.
Perfect. Oh, and then Lexi just popped on too, and Lexi was another one of my students who just landed her job, and she's in school as well, so it's good to see you on here, Lexi. Hi. Oh my gosh, this is great. So yeah, so exactly going back to what Malyssa was just saying, so going into the ICU as a new grad is it can be a very hard thing to do, and I don't care who you are, how strong you are, it's going to be difficult starting a brand new registered nurse job anyways. And so if you do decide to go into the ICU, definitely take advantage of any clinical opportunity or any extra orientation or any so Lexi was with me for a whole summer internship, and it was 12 weeks or 10 to 12 weeks of just her and I working together, and she was able to build excellent skills from just being consistently in the ICU, and then she was able to actually apply and get into graduate school as a as a senior without any working experience aside from being in the ICU for her internship. So so definitely take advantage of all those opportunities you really have, because most of being an important part. Sorry, Tucker's just like running around everywhere. Distraction. So
There he is.
There he is. He knows. Yes, Tucker got to have his time on the podcast too. I'm sure you Okay, I'm at So anyways, yes. Okay, so everything is always chaos, right? So nothing is perfect. So this is a really good example of, you know what, we are real, everyone's real, you know. Sometimes when you're trying to record a podcast, you have your furry friend want to be in the middle of it too. So anyways, back to the topic. So we were talking about going into the ICU, what to do from preparation, and so there's many things you can do in order to prepare yourself to work in the ICU as a new grad, and then there's things you learn you can do in the ICU as a new grad to help you. Sorry, he's still just running amok. That can help you be better and get better and learn more. So again, let's talk about. So Malyssa, I'm gonna have you. I'm going to take care of Tucker. He wants to play, so I'm just gonna tuck him into his Betty Bye basket. So I will have you talk about what you think would help prepare new graduate nurses for the ICU.
Okay, guys. So again, not everyone necessarily has the opportunity to be in the ICU during school. If you do, and you even for a second think it's something you want to do, please take advantage of it. It's so important to get exposure and experience from that. I was very fortunate. I probably had 300 to 400 hours in critical care / ICU experience before I even started as a nurse, just because of the opportunities that were available at St. Scholastica and that I took advantage of. So it really helped me feel more comfortable starting in the ICU, and it really solidified that that's what I for sure wanted to do. I know that a lot of people think it's really intimidating, and it definitely can be, but it's like anything else. It's a comfort level thing, and you know, once you can kind of get exposure to it, and as long as you have a good team around you who can really help you succeed, then you know, it doesn't really matter. I just think that you have to know if you want to do it or not is kind of the bottom line. So I think the main thing is really just trying to get exposure, even if it's not in the ICU, in some type of critical care setting. Like some of my clinicals are also in the ER, which I knew that that's not what I wanted to do, but it's still kind of like a stressful environment with sick people sometimes. And so it's kind of a nice way to get some exposure as well.
So again, exactly what Malyssa just said. Just make sure you're taking advantage of any opportunity to actually see if that's actually what you would like to do. Because once you're in it, you're basically in it.
I mean, yeah, it's a lot harder to quit once you start, right? Not that you can't. I mean, of course, you can always like say no. You know, this isn't for me, but it's better to know that up front than to start your job and, you know, then be in it for 6 months to a year and then be really uncomfortable and really unhappy. And even, you know, if you're on the fence and if you're not sure the ICU is for you, then I would say it's probably best to not start there, to be honest. Yeah. I think unless you're 100% sure that's what you want to do. So
yeah, and I think that will actually lead us right into our next question about, or the next topic about what are the pros and cons about, so you jumped right into the cardiac ICU.
Yep.
I transitioned into a cardiac ICU. I was still in an ICU, and it was full-fledged burn ICU, but there's, you know, every single ICU has its own
different.
Exactly, like they all have their own specialties, and so, you know, like I'm not a neural nurse, like I'm not, like, yes, I've been an ICU nurse for 3 years, but I'm not going to land a stroke patient because that's not what I do. So what are pros, Malyssa, for starting off in the ICU right away as a new grad, and then we'll talk about cons.
I think pro, if you really want to do it and you're able to get into it right away, I mean, good for you. I think, because personally, depending on the person, I don't think it's necessary, to go through the transition of being a floor nurse. So I think it's a huge pro to start where you actually want to be and really enjoy your job right from the beginning. Because I think a lot of people go to the floor or be a med-surg nurse because they think it's kind of what you're supposed to do, and they end up really not liking their job or maybe getting burnt out before they even get a chance to move on and do something different. And I mean, I think honestly that's probably the overall pro. I think I've heard from other people too, is new grads in the ICU, that it's really easy to teach you what's right and wrong in the ICU versus maybe people who started on med-surg or even just a different facility or different ICU might have quote unquote bad habits maybe, or just policies might be different, and so it's a little easier to maybe teach a new grad because it's kind of a blank canvas, I guess, for better or worse.
Exactly.
It's really, you can just teach them everything they need to know versus trying to maybe reteach somebody or learn new policies or procedures. I think there's a lot of perceived cons being a new grad in the ICU, but again, I really just think it goes back to it's all person to person. I think we can both say that we've seen a lot of really successful new grads in our ICU, and we've seen a lot of people who have really struggled and they're not cut out for it. And so I think it's really just a personal thing, and that you hope that you have good preceptors and good managers that are honest with you about, if you are really cut out for it or not, and also just to be honest with yourself and kind of gauge yourself and see if you feel comfortable in the environment as well. And if you don't, then, I think it's important to also just self-gauge and be able to say, I should probably start somewhere else, or maybe it's not for me right away.
And so that, and with that, so starting in the ICU, you have to, as a new grad, you have to be able to self-teach yourself, because yes, you go through your orientation and yes, you have preceptors, but you still need to be able to teach yourself all, because you basically need to be learning how to become a brand new nurse and a brand new ICU nurse all at the same time. And so that makes for a lot of self-studying and times where you're home going over your AACN critical care book, or you're looking at your hemodynamic drips, or you're looking at just the pathophysiology of the specific ICU cases you are working in. And so you really have to be self-diligent in order to be successful as a brand new ICU nurse. And so for the people I have seen struggling or had struggled, they thought they wanted to be in the ICU, but then did not give it their all on the outside of the ICU because they weren't self-teaching, or they weren't seeking out extra education, or they weren't asking for the right kind of advice back. And so you really have to be able to self-advocate in the ICU. And so that is going to be our next kind of topic about really you learn a lot about yourself in the first year or two of nursing in general, but just having to, you really learn to self-advocate. So I will let Malyssa talk a little bit about that, about your experience having to self-advocate for anything and everything for yourself, and then becoming a patient advocate in the process too. Yeah,
you have to do both. You have to learn how to do both. But absolutely, I think, self-advocate and just being in self-discipline is really important when you're starting out in the ICU. They always kind of say a general rule is 6 months to feel comfortable as a brand new nurse, and then usually a year to feel comfortable as a brand new ICU nurse. And I would say that's very accurate. So I think if you're thinking about doing it, be prepared for that. I would say I probably did not start to feel comfortable until after my first year, or at least close to it, and kind of feel competent in what I was doing. And I would say, based on people that I've talked to who are new grads, that's pretty accurate across the board. Not necessarily that you're not competent before that, but it's a self-perception thing and it's a comfortability thing. And I mean, definitely, as Dani was saying, it is a lot of self-advocation for just teaching yourself. Your preceptors will teach you what you need to know. You'll learn what you need to know to take care of your patients properly. But to actually keep it, locked into your brain and or just build upon your experiences. I mean, you definitely have to be doing stuff outside of work or at work. I was definitely the person, like I was at work, and especially on night shifts, my first 6 months to a year, I would have like a notebook with me every single day, and I'd have like an ICU nursing book and a cardiac book, and I'd bring them all with me to work every single day that I worked nights, and pretty much I would be reading them the entire night shift when I had downtime, because as we all know, during nights, your patients are mainly sleeping for the most part. So I would be reading up on things that I was unfamiliar with or things that I want to get better at, and I would be taking notes in my notebook, so it was like a little quick guide for me to refer back to for when I maybe had really sick patients or I encountered something that I haven't had in a really long time. So, I mean, I'm not saying you have to be like that to be successful in the ICU, but I mean, that was literally me for like the first year.
Yeah, it's being really diligent, and it's taking advantage of all your time while you're at work, when you have, and if you have downtime, to spend a couple minutes looking at things, and because you need to advocate in that sense, and then you also need to advocate, in your orientation process or within your first 1 to 2 years of, hey, I haven't seen this kind of patient yet. Can I shadow this happening, or can I follow another nurse doing this, or can I have an extra week or 2 of orientation? Because I asked for 2 weeks of extra orientation, both when I started in burn ICU and then when I transitioned into surgical ICU. I asked for the extra orientation because I felt at that time I did not see enough of what I had wanted to make myself feel comfortable. And so you have to ask for what you want, and like sometimes you don't get it, but at least you can ask for those learning opportunities,
Yeah, and I definitely, I remember being on orientation, same thing. I mean, I made sure that, during my weekly check-ins or whatever it was, that I absolutely was open and upfront about certain patients that I hadn't gotten the chance to see, especially, core population patients for my unit that maybe I hadn't felt I had enough time with. So, I mean, basically like structural heart type stuff, since I was on the cardiac ICU. So if I didn't, when I didn't feel like I had seen or had enough experience with those, I always made sure to ask. Not that it'll always happen, but at least you can be an advocate to yourself and put it out there. And if you have a good manager and a good preceptor, they'll try to make it happen for you. And another thing that I always did too, again, not that you have to, but, and it depends on the environment you're in. I work on an amazing unit, even still that we're combined now. I've always had amazing coworkers who are very supportive of me, which obviously makes a huge difference.
Yes,
I hope that every one of you...
Culture is so important.
It is, and I hope that every one of you is lucky enough to end up in an environment like that. So people were so always very helpful and nice to me and accommodating of questions that I asked, which I had a million of them when I started. And so like if I had... maybe like 6 months in, and there was somebody who had a balloon pump patient or a TAVR or post-arrest, or like maybe a really sick cardiogenic shock patient that I wasn't experienced enough to take at that time, I would, when I had downtime after I was done taking care of my own patient assignment, I would go and sit in the room with them and ask them questions about their patient. So, like, okay, well, what drips are they on, and why are they on that, and what does this do, and why do we choose this over that, and really just getting to know the patient. And I mean, I would go into every like balloon pump route, because I thought it was like super interesting, and I'd ask them about it. I mean, this was a year and a half before I was trained in to take those patients, just because I thought it was cool and I wanted to know more about how it worked and why we basically put them in people, I guess, why is it necessary? So that was also something that really helped me, I think, just like make myself feel more confident and more competent within that year time frame as well. So
yeah, absolutely. It looks like Serena is on here. Yes, and so she says, "I'm not a nurse. I just like to listen." But Serena, you are so important.
We love you, Serena.
We love you. So you are incredible. Absolutely incredible. And you had mentioned one thing. I'm going to try to scroll up here without quoting this out. So Serena says, I'm sure even nurses with 5, 10, 15 years of experience are still seeing new things and coming, up with new stuff constantly. Yes, you are 100% correct, because that's one of the new things, or that's one of the important things to recognize or to know or understand when you're starting out in the ICU as a new grad. It's not like one day you'll just reach your 1 to 2 years and you just know everything.
Absolutely
it's just not a thing. So you will always be exposed to new things as our healthcare world continues to develop. And so you are 100% correct, Serena, that yes, so even as our technology continues to improve and better, and we get smaller devices, and we go from the balloon pump to all the other structural heart assistive devices there in CICU, so it's definitely, we will always have something brand new to see eventually.
It's definitely a lifelong learning job for sure.
Yes, exactly. You know, you're not just done after your 1 to 2 years of nursing school.
Yeah, you're not an expert after like this time frame. Yeah.
Yes. Oh, and then another important thing, everyone, you know, so during this COVID pandemic, like I talked to a lot of nursing students, and the nursing students have said, hey, I'm so worried about not knowing enough once I get into the real hospital world or the real acute world, because I'm not getting enough clinical time, or I'm not getting enough grinding time in the actual nursing labs. Well, let me tell you, you learn most of what you need to know when you're out of school.
On the job.
On the job, yes. So you go ahead, you study hard, you pass those boards. Then once you're in the ICU, we will teach you.
Yeah.
We were taught by fabulous nurses who I look up to every single day, and I work with nurses who I look up to every single day. They're incredible.
We're very lucky.
Yes, exactly. Very lucky, super intelligent women and men, of course, because there are nurses. So, so then just kind of going back to what Malyssa was saying about needing to self-advocate and to educate yourself, and having, you're writing things down, and you basically have this like ongoing list of things you're building. You have your nursing foundation from school, and then you have your orientation, and then you have whatever unit you're going to be in. And so if you're flow pool, this might not necessarily apply to you. But you need to know your core population well, and so then that should be your next step. You're really focusing on learning. And then just in regards to every single ICU, you should really have a kind of like a wish list. How like you were talking about, I was going through, like you wanted to know more about the intra-aortic balloon pumps, because eventually you were going to be taking them. And so basically you kind of like write down your own wish list in your little notebook of things you want to learn or things you should learn, because eventually one day you will have those patients, and it will help you immensely. Even just looking at just the waveform, looking at the augmentation, and just learning a little bit more about timing and things will definitely help you in the year or so afterwards when you're actually licensed or licensed.
Yeah, certified, I guess. I don't know. Taught how to do it. Yeah.
Thrown into a room, right? I'm just gonna scroll here. So we can talk about, we talked about that. So one of the other hot topics here that people wanted to know, so we can kind of talk about just, so if you don't, so one of the questions, so it's more specifically on, pros of being an ICU nurse right out of grad school. So on the con side, there is value in, so if you aren't sure you want to be in the ICU, you don't have to jump directly into the ICU, and you can definitely start on the floor, because there is great value to learning how to be a nurse first, and then kind of deciding where and what you want to do with that. And so I'll let, so I'm sure as a new grad nurse, you've heard many people talk about why people should start on the floor. So can you talk to me about a few of those things you've heard, and why it could be beneficial if you aren't sure?
Yeah, I mean, I guess the two main things that I always heard were time management was a huge one. Everyone said if you don't, you learn your time management on the floor, which, is true. I mean, because on the floor, you might have 4, 5, 6 patients at a time, versus in the ICU you have 1 or 2 max. So you definitely probably learn time management more quickly on the floors, because you have to.
You don't have a choice.
You really don't have a choice, because you have so many people you're taking care of. However, I guess, the argument for that is that the ICU and the floor is they're different types of time management. Again, on the floor you're managing several different patients at kind of like a surface level, so to speak. So, you're doing like focused assessments, and why are they here, and those kinds of things, versus in the ICU, you're really diving into pathophys and why is this happening and how the disease affects the entire body. And so obviously that takes up a little bit more of your time as well. It's just that you're doing it for 1 or 2 people versus 6 of them, because obviously if you had to do that for 6 patients, nothing would ever get done.
Nothing would ever get done.
So that'd be my argument against that, I guess. Not that it's not important. I mean, I think, if you get into the ICU and you are struggling with time management, you're going to have a hard time for a while, for sure.
Yes.
I think if it comes naturally to you, you'll definitely have an easier transition. So again, that's kind of a personal thing. No one wants to hear that. It's really like a time experience type thing. And also another one that I heard is just kind of, you don't know what you don't know. So,
Yes.
which is true. I mean, you don't. So, a lot of people said, you know, basically if you start on the floor, for instance, you know, if you're interested in being in the cardiac ICU, maybe you would want to start on your post-cardiac floor. So for instance, you know, we have the cardiac ICU, or we used to be the cardiac ICU, and then we have a post-coronary care unit, which is where pretty much all of our patients tend to go after they're not, don't need to be in the ICU anymore. So that, like, for instance, that would be a great place to start if you're interested, because you just see the less critical side of them, so to speak. But you still learn kind of about the policy, about the procedures, and like this like structural heart patients and stuff like that. So that was kind of a really popular comment that I heard too, is that you don't know what you don't know, and so it's easier to kind of learn maybe when a patient is like declining or going downhill, if you have experience on the floor, versus if you get into the ICU and you always have super sick patients all the time, basically. Is that it might be more difficult for you to identify maybe when something is going wrong, or when to step in, and maybe your sense of urgency isn't as high as it needs to be. So those are probably the two most common things that I heard for sure for people who are not necessarily supportive of new grads in the ACO.
Yeah, and again, like all of this is just hard truth. It is authentic, and all this is real. Like, we are not going to sugarcoat this whatsoever. And so if you are a new grad in the ICU, you will probably hear some kind of a kickback in some sense, because some people strongly believe you do need to have experience coming into to the ICU. And then that's where, you know, like you can just say, I understand, but you know what, I'm gonna do my absolute best to teach myself and to use my resources in order to prove to you, and to myself, most importantly, that I deserve to be here, because I'm gonna work hard in order to be here.
Yeah, and that's, I just think be prepared for that, for sure. You know, like, again, I was very lucky. People are very supportive of me. There are always going to be people who are going to be welcoming of you, and there are always going to be people who think that you don't deserve to be here until you prove them wrong, or until, you know, you prove yourself competent in their eyes. So I think just be prepared for that. That's kind of everywhere, though, but
Yeah.
I think it's just a little amplified in the ICU, just because your patients do tend to be super sick. So I can't see what Allie said.
60s.
Yeah. 60 shout out.
60 shout out. Oh, this is great. So mental stamina and emotional stamina are two big things you need to make sure you are pretty well solid on. You need to be able to get through your 8 or 12-hour shift, and then you have to get home and function. And I mean, you can't just drool on the couch when you get home, because girl, you have work to do. You have things to learn. You have things to review.
Yeah.
You know, because even just with this combination, I have all these brand new things I have to learn now. You know, line pulls, line pulls were never a thing for me.
Yeah,
and
for sure.
So
yeah, and I'm taking a post-op hearts,
yeah,
and we don't do that, so yeah.
There's like, you will literally always have something new to learn, and you really have to hone in on what is going to make you mentally and emotionally strong, because like she was saying, you will have and can have a lot of negative comments, but you will learn to just go ahead and be stronger, and it will make you stronger. Being in the ICU, it makes you a whole different human being, most for the better, and a little bit of just your sass and your dark humor, just dark and twisty. You just get a little bit dark and twisty because you're just exposed to a lot. So next, we'll just kind of talk about, so I do know there is a lot of interest in kind of talking about what's really important about just what you should really be able to do well as a new grad going into the ICU, and what you should focus on.
Sure.
And so like things like complex assessments, and then knowing your vitals, and so just kind of like touch base on a few things, and your like learning process on that too.
So I mean, definitely, like, if you don't have the basics of being like a nurse kind of under your belt, or you're at least confident in them, for instance, like doing a complex assessment, so like a full body head to toe assessment that's in depth, because in the ICU they are very in depth. So if you're not confident with doing that, or like passing meds, or like giving stuff through a feeding tube, or kind of more like, I guess I don't want to say basic nursing skills, because not everyone experiences that, but like if those things really make you nervous, or you don't feel confident in that yet, then you shouldn't be in the ICU. I'm just going to say that right now, because you will feel overwhelmed, and it will be really stressful for you. And then the other things, you know, that you don't really have to worry about, I'd say, are like, don't worry about like knowing all the medications, like, you know, having them memorized. I mean, that just comes with time and experience and asking questions. Like, that is definitely not something that you need to have, like that you feel like you need to have like memorized before you go into the ICU. Like you will learn what you need to learn when you get there. But pretty much like basic nursing skills, like you need to be at least comfortable and competent enough, to perform head to toe assessment, and like make sure you know your vitals, and at least sort of comfortable with some heart rhythms. I would say, like obviously just like general, like know what's good and know what's really bad.
Know which one's to shock and which one's not to shock.
Yeah,
Super important.
Just know like what's good and what's acceptable and what's not okay. And I would say just the most important thing too is just like have, one of the things I heard all the time too was have a sense of urgency. If you think something is wrong or going wrong or you have a bad gut feeling, then you need to ask somebody about it or tell someone or do some more investigating or whatever it is, because 9 out of 10 times, for better or for worse, you're probably right. And so I think there's a really fine line between being super anxious being in the ICU, but then also being way too laid back at the same time, especially as a new nurse. Maybe once you get some more experience, but as a new nurse, you need to for sure have a sense of urgency to know when to ask somebody for help or to say something.
Yeah, absolutely. And like, you never have to be afraid to ask questions. There are going to be nurses who won't accept you asking questions, and then that's fine. You can go on to the next nurse, because believe me, there are plenty of other people who are willing to help you because they have been there too. When I started off in the burn ICU, I had the most amazing human beings teaching me, and I felt like I could always ask questions, and it was a wonderful experience. And the same thing happened when I got to SICU, just a little bit more of that kickback to newer people being in the ICU, but it's just a culture. I don't necessarily accept that culture, and I have a whole other episode on that, but we won't dive into that. But there will always be someone who will and who is willing to help you. You do not be afraid to ask. These are people's lives you are dealing with, and this is your license. You have the right to protect your license and to protect your patients.
Yep. And I would say for sure, like, just as a little tidbit, absolutely, find those people who are willing to help you and who are good teachers and who are willing to answer your questions, and really hang on to those people and make sure that you keep them close so you can have them when you do feel like you're in trouble. Because again, you are always going to have some people who are going to give you a little bit of pushback when you're new, kind of until they get to know you, and for until to them they think you're able to be in the ICU.
You gotta prove yourself.
Yeah, and it is what it is. I just think you have to have a little bit of tough skin and just realize that that's going to happen. Because as Dani said, that I think it is shifting. That culture is shifting because we are seeing a lot more new grads in the ICU, but it's definitely still there. Some of those older, more experienced nurses, they all had to have their time on the floor because it wasn't an option for them to go in the ICU. So it's going to be there for no matter what. So just realize that. And I think that just handle it with a little bit of grace, which is really hard to do sometimes. But just realizing too that I think, we were all new once, and we all used to have questions, and we all didn't know everything at one time, or think we knew everything, or whatever the case may be. And so people just tend to forget that the longer that they're in nursing. And so some people can be a little abrasive, but I think, it's
abrasive.
Yeah. So it's just, kind of take it with a grain of salt and just try to not take it personally, because it probably has nothing to do with you as a person. It's just
definitely not.
Yeah.
So then exactly what Malyssa was just saying. So you really have to be able to be coachable. I think that's another really important thing. You need to be able to take constructive criticism.
Absolutely.
Because most of the time it's not going to be constructive. It's just going to be criticism. So first of all, you have to get to the ability to take constructive criticism, and then you have to be able to understand that when someone is giving you some kind of feedback, it's usually in a high stress situation, and so someone might be more apt to not say it as eloquently or as calmly as your nursing instructor would. And so you just need to be able to be coachable and just know if someone's giving you advice, it's usually for your own good. And the ability to be coachable is undeniably one of the most important things you need to be able to do as a new grad in the ICU, because you're learning to be a nurse and an ICU nurse all together in one. And there's so much to learn, and like you will never know everything. There will always be something for you to actually learn, and so you need to be humble and you will have humbling experiences no matter how far you are in. You know, like if you ever meet a nurse who says they have made, or if you've ever met a nurse who has said they have never made a mistake, they are lying to you.
They are lying to your face.
They are lying to your face. We are human beings, and that's just the way it works. And so just be coachable, and everything will be okay in the end. Sunshine and rainbows, right?
Yeah.
No.
So, some days, I guess.
Yes.
Yeah.
Depends on the day. So yeah, so just kind of like look through the comments here, but we can see if there's any other questions through that, and then we can just kind of look at, we talked about not developing bad habits and hard truth. And so aside from what you need to know for ICU new grads, just what were your misconceptions about going into the ICU as a new grad? Like what were like, learning moments, like I didn't think this is actually how it was, but like you have two parents who were nurses, so you're kind of a little different. So
well, and and I also, like I said, I got lucky enough to really almost all my clinicals, with the exception of basically my sophomore year, were in the ICU environment. So I think I had a decent idea of what to expect because I did have great preceptors my entire clinical career, and so I did get really good exposure to it. I guess like maybe I was surprised that even with all my experience and exposure, that it still took me a year to feel kind of comfortable and competent in the ICU. And I think maybe at 6 months or something, you kind of get like a false sense of comfortability.
Yes.
And then it's like a year, and then you're like, oh no, like this is actually what it's like to be pretty comfortable taking care of like these patients and like actually knowing what to do and intervene in the right way. So I don't know if that's really a misconception, but maybe just like, you know, when people said, oh, it'll take you a year to feel comfortable, I was like, okay, I mean, you know, I accepted that or whatever. I was prepared for that, but I guess I didn't really think it would actually take you that long, and it definitely did for me, for sure, 100%.
Absolutely. Same here.
Yeah.
Again, for me too. It took me, you know, just I was building, you know, a good amount of confidence and amount of comfort, and if you're 100% comfortable in the ICU, either you've been doing it too long, or there's something else going on, because you know, or you've just been in that one specific field for 20 years and it's very procedural, you know, where you see usually the same 5 to 10 patient cases. So so there are always the gray area where it is acceptable. However,
that's probably and that's probably a better question for you. Like, did you have, like, when you went to the ICU, maybe even from switching from burn to SI, like, were you like, oh my god, like this is not what I thought it was going to be like?
Yeah, and so I actually, I don't know if there's any people watching who are in SICU, but I did not know there's, like, again, I didn't think I was qualified to land open heart patients. However, I had this misconception that once I started there, that was the patients I was going to be taking.
Oh,
and I didn't think there was this like grace period of you get to learn how to take care of post-op day 1 patients instead.
Yeah.
And so I literally spent like a month of that summer before I started in SICU, like learning almost everything I possibly could, because I was so sick to my stomach about having to land open heart surgery patients. Yeah. And so, but again, that was a misconception. And just so I was an LPN for 3 years, and I worked in rehab, and then I went from rehab nursing into burn ICU, and burn ICU is an ICU with burn patients, you know, obviously burn intensive care. Yeah. However, there was a lot of overflow patients, so it was like one of the best transitions from LPN to RN. But just from the misconceptions of going from, I have nursing experience already.
Yeah, sure.
But it was so much different. It was so different. So misconceptions I had is that I didn't think it was going to take me that much longer either, because I already had learned, you know, basic nursing interventions. However, I don't. So like, no matter when you're transitioning into any ICU or into any new floor, there is a learning time, and you do need to give yourself that grace and
have patience with yourself.
Patience.
Yeah,
yes.
I was really bad at that. Just to be honest with you, I was like super like I was frustrated that I didn't feel more comfortable sooner because I just felt like I should, I guess, but that's just me as a person. So, but try not to be hard on yourself, you know, and you are going to make mistakes, and just try to, you know, it is what it is. Everybody does, and it happens, and, you know, just try to be patient and kind with yourself. I was definitely reminded of that several times already throughout my 2-year career to be a little bit nicer to myself and not quite so hard on myself. And I think that's a really important thing to do. Like, it's already hard enough to learn how to be a nurse and learn how to be an ICU nurse. You don't also need to be like your own worst enemy on top of it. So that's just going to make your life miserable.
Yes,
so
exactly. Because the more time you spend hating on yourself or thinking you're doing something bad is like more time you could have been spending reaching out for help or for working on your mental stamina or just focusing on your mental health, because believe me, it is so important to work on your mental health as a new ICU nurse, because you know, you have this like imposter syndrome of, oh, am I gonna make it? Like, like, am I doing this good? Like, what am I doing? Or some days, you know, so some days you leave work feeling like $100 or $1 million. And some days you're in your car even after 2 years going,
exactly.
Yep, you just drive home with no music on. You're like, okay.
You know, that's a bad day when you don't play music in your car on the way home. Yes, it is. It's true. You know, you'll have days like that no matter what. And I think, you know, the more experience you have, they're probably fewer and far between. But definitely when you're starting out, you know, it might be every week that you work. You might have like a really good day, and you might have a really bad day where you really feel like you're just not cut out to be there. And I for sure went through that a lot during my first year. A lot. Yep. Lots of tears, lots of self-doubt.
Lots of wine.
Yep. So, I mean, yeah, it is. And that's just another thing where, you know, if you're the type of person where, you know, you can't handle that, or you just don't want to, you know, some people don't want to have a stressful nursing job. You know, and that's fine. And, you know, so there's plenty of other options out there. That's why there's, you know, all these different types of nursing you can do. There's something for everyone. So
absolutely. So then just on that topic, so I think we'll do like another 3 more minutes on this topic, and then we'll kind of talk about some more fun things in the end here to finish out the hour. And so if anyone's still watching, if you have any questions,
if you have any like burning
go
questions,
ahead.
For sure.
Yes.
What did Allie say?
I'm glad you stuck it out. Mal, you're such a fabulous
Allie,
nurse.
you're the cutest.
Oh my gosh.
I love you.
Fun. So yeah, so we'll just so words of encouragement. So on that exact topic, brand new grad nurses, you going into the ICU, or just new grad nurses in general, you need to find who your people are. You need to build friendships. You need to build trust within the people you are working with, because when a cold blue happens, or when shit hits the fan, you need to be able to trust and to at least have a professional relationship with who you're working with. And so building trusting friendships and relationships at work, and just knowing who you can go to for help, is going to help you immensely. And you know, there's always going to be someone who can help you. Like I had a crazy day, and I had to, and I had a scan downstairs, and it was shift change time, and Malyssa came to the rescue at the end of my shift, and you know, we just worked together to get the patient all cleaned up and taken care of. And you know, you just there's always one more thing you can do for someone you are working with. There's always one more thing. So just always try to go above and beyond, not just for yourself and for your patients, but just for everyone in your unit.
For each other, your coworkers, for sure.
Yes, like bringing in really good food, or muffins, or everything. Sure. Yes, bring in all the
just always
goodies.
Feed people. You'll make friends really fast.
Yes, absolutely. Oh my gosh, fun. Oh, Tyler Gregg's on too.
Tyler,
and
what up?
Danny K. Yes, so Danny K is actually one of those nurses where, like, during the combination, I was just like, I'm going to listen to everything, and I want to learn so much, and so thank you.
I'll say this a million times over, especially because she's on here. Like, our weekend is bomb. We have literally the best weekend. Everyone on our weekend is amazing, and we all work crazy well together.
Yes.
So it's like, even if it's a terrible day, at least we have each other.
Yes,
so,
absolutely.
And that really does make or break it so much. It's like unreal. I mean, you know, it's like you can have at least you know, if you're having a bad day, at least you have good people around you.
Yes.
It's 1,000 times worse if you're having a bad day and you also hate everyone that you work with, or you don't get along, or you just don't talk to anyone. Like then it's like you're probably ending up with really terrible coping mechanisms because you have no one to turn it to.
Yes.
So
And so it's important to facilitate those conversations, right? So, or to I just see what I want to see what that says. So yes, it's super important to facilitate all of those. Dani and I will take credit for teaching Malyssa everything she knows. Oh, Tyler.
oh my god, it's
Oh,
true.
Tyler.
I seriously, like, I would talk up CCU nurses all day long about how good they were to me when I was a new grad. 100%. I literally text Tyler Grad like on his wedding day, and I was like, congratulations, like seriously. I was like, thank you so much. I was like, you were. I was like, since I was a student in the ICU, you were always good to me. You always helped me learn. You always, showed me everything that you possibly could, and you always let me have all the opportunities that were available, So I did. And go out of your way to thank them too. Precepting is
Makes them feel really good too.
Yeah. Well, and precepting is. I'm one of the maybe rare people who I enjoy precepting and I enjoy teaching, but it is hard, and it
really
is
hard.
Stressful, and it is time consuming as well. And it's just a different mindset, especially once you're established. You have the certain way you do things, and you just kind of go through the motions. And so to kind of stop and take some extra time and explain what you're doing and why, it just it takes a little. Yeah, it takes a little extra mental energy, and so just to make sure you're thankful to the people who did help you when you were, learning, because it is really important, and it's an important job to have. Just make sure you're thanking people for taking the time to do it, for sure.
Yeah, and whenever I've had like a student or anything along those lines, they were so gracious and had given a gift card or coffee or something. And so just all those little tiny things really does add up, because nursing is typically not a thankful job. Like, patients don't really get the opportunity to thank you because they are usually too sick or they're intubated. So
or you have a day off and they're gone, or like whatever.
Yeah, exactly,
I don't know.
Exactly. So don't forget to say thank you to everyone around you, and just so on the side of like being around positive people, you also have the control to be a positive ray of sunshine on your shift too. If there's a problem, you can talk to someone about it, and just don't bring down the energy of the whole unit. Like, just check yourself when you come into work, leave work at work. It's harder, it's super, super, super hard, but then also leave home at home, and just try to have. It's really hard to do, and it's like I'm finally just learning how to keep work at work, and I've been doing. I've been a nurse in between the L and the R for over 6 years now, so I'm just understanding it like this year. So
yeah, it is. It's a really hard thing to learn, for sure. I think for anybody.
Yeah. So I think that kind of wraps up on all the questions we've had and kind of the things we wanted to touch base on.
Yeah.
Becoming a new ICU nurse or a new grad ICU nurse straight out of school, hot and steaming out of school. So let's see here. So as you can see, she is a very beautiful human being, and she, if anyone here works alongside her, love is mutual. Like you can, she always has the most like well put together outfits, and her hair is adorable. She has like the cutest accessories going on. And
I do not look like this at work, for the record. Nobody's ever seen me this cute at work, but
yes,
I mean,
she is always cute. She is seriously always cute. And so self-expression at work is so important. So I'm just going to kind of let her talk about why she chooses her outfits, or why just explain why it's so important to express yourself through your taste.
I mean, I guess for me it's just important because, I guess I've never done anything really different. I don't know, maybe when I was younger I would kind of like, follow the status quo or whatever, but nowadays I'm like, why? I don't know, life is too short, you do you, like, if, there are certain things that make you feel good, or it's easy as doing your makeup when you go to work, or having your hair done, or whatever it is,
or having a really cute polka dot, or some kind of headband.
Like headband, yeah, or like do the dang thing. I don't know. It's like we all have to wear boring scrubs. And, like, I don't know. We all look the same. Especially now that we're wearing masks and scrubs. Like, literally, it's like half of us. Like, you can't even tell who's who anymore. Yeah. Like, I swear. So yeah, I don't know. I think it's just important to, just like keep yourself at your core, no matter where you are at work or out and about or whatever, and just do what makes you feel good about yourself, you know?
Yes, and don't buy dance clothes. Do not use them
Yeah,
at
no,
work.
you'll literally
You
break
will
your ankle.
And I don't know if Allie's
Literally.
still on there.
Yeah.
But like she has a story.
Allie.
I have a story. Like
Allie almost broke her ankle.
Yeah.
I've almost broken mine multiple times. I literally, I was about 2 weeks in and I was like, oh, my feet feel so much better, but I almost broke my legs, so not worth it.
I mean, they do help foot pain. Like, don't get me wrong.
Yeah.
Like, I don't want dance school to come like after us
Yeah,
saying,
yeah.
oh my gosh,
No,
she's
they
doing
do.
this.
They do what they say.
Yes.
Like they prevent your foot pain and they prevent back pain. You are at risk for breaking your ankle.
Yes.
I don't know who.
And if you're clumsy,
it literally is. Yeah.
I'm clumsy, and I literally took. I don't think
It's
I was.
unreal.
Yeah, I don't think I was in the ICU for maybe 6 weeks into my orientation, like in burn ICU, and I literally took out an entire tray table in front of my preceptor, in front of the patient, and it was like a very stoic nurse who was just like, Are you okay?
Yeah.
I'm like just beat red, embarrassed, and like I can barely feel my foot. I'm
You're like, no, I'm not okay.
Oh my gosh, it's fine. I'm like, and I literally like never wore them again, and it was just, I can't.
Same thing. I think I tripped in a patient's room once and literally almost broke my ankle. I'm pretty sure it was Katie Knight saw me. She's like, oh my god. She was like, are you okay? And I was like, yeah, because I caught myself. Thank God my patient was intubated. They didn't see anything.
You stuck the landing.
Yeah, it was. And that was the last day I wore dank scales. It was never again. Never again. Really,
what
guys.
does this one say?
It's probably
Ran
Allie
to
about her
cold
accident.
blue. Yes. Ran to cold blue from the cafeteria and twisted my ankle twice. Oh my gosh, Allie.
Literally.
Yeah. No. Oh no.
I don't know, guys. They're not safe. It's like a safety hazard.
It is. Like, I think they should come with like a written warning on the box.
It should. Yeah. Just like buy really comfortable tennis shoes and call it a day.
Yep. And then have your really fun color pop like in your socks.
I wear fun socks.
That's what she does.
Yeah.
It's like super
I wear
cute.
really bright socks.
Hot pink socks. Like I always know it's like pink day. She has like pink like accessories on, and then she has her pink socks. And so you can get really fun even though you have to wear the same boring color scrubs
every single day.
Yes, like don't be afraid to self-express, and you know, if makeup is your thing, great. If it's not, great. Like you do whatever makes you feel comfortable. Because I know for me, it makes me feel more professional to have something on my face and to present myself, because it's imposter syndrome. So you're going into the ICU and you're like in your 20s and you're taking care of people who are in their 60s and 70s, and they just think you're like a little child.
Like you're like a child.
Like, are you even old
do you
enough
even
to
work?
take?
Do you even work here? Are you old enough to take care of me?
Yes. So having that little bit more of like put together face on like helps to make you feel more confident and being able to talk to.
Now it doesn't matter because all they see is this half your face anyway. So how's anybody gonna tell?
All I can do is this, and I think I'm gonna get like all these lines across.
But under normal circumstances, yeah. I did used to wear makeup to work, and then we had to wear masks every day. So now it's just really not worth it for me.
Yeah, and the whole mask me thing, girls can, if there's like people
so
like it is so bad.
It's so bad. It's a real thing. Yeah, it's terrible.
So if you have any tips for dealing with masking me, like put them down there and like share them for everyone to know, because I finally found a couple products where it has helped, but just I feel like we're gonna be in this for the long haul. So any tips, please help us share, and I will share them more. But
yeah, I actually I don't know, what have you been using? Honestly, I cut way back on like the stuff I was using. Yeah, you should.
Okay, I'm gonna do a product share. Okay, just 1 second. Yeah, so we can talk about.
I just still see Allie's comment about her.
Oh yeah,
almost
the code. Yeah,
tragic accident.
Falling onto the tray table. Oh gosh, so embarrassing. So yeah, so if you have a product you have, you can go ahead and talk about it too.
Oh my god, well honestly, I just I really cut back on the stuff I was using, honestly, Dani. Oh my god, she can't hear me. I'll tell her when she gets back, but masking is a real thing, you guys. My skin is so bad right now, it's terrible. Thank God you can't tell from here. This camera's amazing, but it's real bad. Yeah, but seriously, I just literally cut way back on what I was using, honestly. I feel like I used to have 1,000,001 skin products, and literally now I just use CeraVe, and I literally use azelaic acid, and that's it. And
so I use
that's all I do.
Face wash too, just like the
normal
gentle
one.
cleanser. Yeah. So so you don't have to buy a $30 product full for your face. You really don't.
I used to, and now I'm it's not necessary. I don't know, not for me.
Yeah. So then I use the same. Can you say that again? Azelaic. right?
Azelaic acid, that's what I use.
Yeah, so most people, so like once you start like your acne regimen treatment, so again, this is not medical advice, this is just what we have found. So
We're just talking now.
Yes. So go to your dermatologist and they will probably prescribe you something along these lines. So so we just went through Twin Ports Dermatology here. That's where I went.
Yeah.
I'm just like, shoot, like I don't want to speak for you, but yeah, so adaptogene gel or 3.3%.
Yeah. And so like for me that was way too aggressive. Like my skin hated it.
Yeah,
freaked
it
out.
was super dry. So like I had like half this tube yet, and I got it back in like January, I think.
Yeah. So see that like for me that did not work because it made my skin extra dry. It actually made it worse.
Yeah, so you don't want to over dry your skin either. So if you're not using a moisturizer, you have to be using moisturizer during this time, especially as we're transitioning into winter.
Yeah, very quickly up here.
Yeah, and then this is a empty bottle because this one actually worked very well. My second one's coming in, and yes, that's the azelaic acid.
Honestly, it's amazing, you guys. I don't know.
This stuff is life changing. So this one really helps too.
Yeah, shout out to Dani Lindberg from Dani Does Brows because she's the one who introduced me to azelaic acid.
Oh my gosh!
So huge shout out to her. Like literally, it changed my life. That thing, it works amazing for me.
Like if I have like that wow. Words are hard. Cystic acne or hormonal, whatever, big, gross, painful things. That takes care of it. So it's really impressive.
Yeah, it's amazing.
And then this is just like, so once I got that, it's like once the root causes of that have been dealt with those products, like now this is the only other thing I use, and it's just the, so it's just a 5% benzoyl peroxide. But this is the only brand here, and I literally just got this maybe 3 weeks ago, and it's like taking care of like everything else. Like I usually have like 15 of these, and it's just like melting everything else off. So I don't know. So this is just nothing. That's just a serum. So yeah, so those are my products.
Also, pimple patches. They actually work. They're so amazing. I remember when I first heard about them, I was really doubtful. I was like, this is fake. I was like, this is not real. I literally tried them. Well, first I did research and I was like, okay, actually it makes sense because all you nursing people, it's literally just basically like a super mini hydrocolloid dressing. So like hydrocolloids, like they wick away moisture from things, right? And help things like heal from the inside out. So it literally just heals your pimple. It basically pulls all the gunk to the surface so it closes quicker and it literally closes it up.
And you can wear them under your masks.
Oh god, yeah, because we wear masks now. No one can see them. I wear them at work all the time when I have them.
Yeah.
Seriously, wear them overnight. I'm not kidding. Literally, your pimple is gone like the next day. It's insane.
Do your skincare.
They actually do work. Yeah, I was very doubtful, but they work extremely well.
Yeah. And
whoever invented them is a genius.
Like, so there's a green package, and so I'm trying to think of the brand. But there is one kind that I found that didn't work. Do you have one that hasn't worked, or have
no? I've only tried a couple different ones. I've tried the Mighty Patch, which you can get at Target, and then there's another brand that I tried off Amazon. I can't remember what that one's called
though. So I've only had one product. Yeah, so I had one product, and I don't remember. So I guess I should be able to pull it up and say something about it before I say it doesn't work. But I will put a list of the products we were talking about as far as like what it's doing to help our skin on the Instagram post or on the Facebook post that will be made with this live video. So I'm just gonna kind of scroll through one more time, see if there's anything else. Is there anything else that you would like to chit chat about skincare, hair care, or anything along those lines? Yeah.
But
I'm like right here.
Maybe we'll make like an extra episode, and for people who actually want to know about this stuff, because I can really talk about it forever. I'm sure Tyler's real interested.
Yeah, I'm sure Tyler is really interested. Yeah.
I'm sure he's just jazzed for talking about this stuff.
Oh my gosh. All right. Well, I think those are all the questions answered. Yay. So thank you so much for tuning in to the first Couchcast, the Bedside Dinner podcast.
It was so cozy.
Yeah, it was cozy. We got our blankets. Yes, our cozy fall clothes. So I hope you have a very peaceful rest of your Sunday here. And this episode will be edited and uploaded. Hopefully, should be able to finish it by the end of the night. But this video here will be up on Facebook and on Instagram. So make sure to stay tuned. And if you have suggestions for upcoming episodes, please let me know. I'd love to give you guys what you guys want. So again, thank you so much, Malyssa, for being here.
Thank you for having me. Hopefully I'll see you guys again on here.
I'd love to have her back.
I'm so proud of Dani, honestly. Like, I don't know how she does this. She's like a superwoman. Literally is in school, she works, she's doing this. She goes to the gym every day. Like, I don't understand. throw a child in there next
Yeah.
or marriage or something. And just
No,
kidding,
no,
she's
wait,
not
no.
ready for that.
Yeah.
But still, I'm like, literally, I don't know how she juggles it. So seriously, like, kudos to her. This is amazing. So
No,
proud of
thank you.
her. Like, chase your dreams, people. I don't know.
Yeah,
Because,
chase
like,
your
you know,
dreams.
if you don't do it, nobody else is going to do it for you. So,
Because, like, believe me, like, I'm like the last person who would have ever thought to have had wanted to do a podcast with a little underlying speech impediment. But I'm like, you know what? Whatever.
Yeah.
It's gonna be what it's gonna
Embrace
be.
it.
I'm gonna embrace
Yeah.
it, and like this will actually probably eventually fix it because I'm getting over my social anxiety, fear of public speaking.
There we
So.
go.
Let's see here. Fun listening. Thanks, ladies. Thank you so much. All right. Well, until next time, guys. See you later.